On the 29th of October every year is a special dedicated day by the World Health Organization to celebrate and to create awareness on stroke. It is on this note that the Remo Gooners family, which cut across the 3 local governments in Remo, we came together to create this awareness and to sensitize people on the need, on why stroke matters, the causes and the effects of stroke. I have with me our invited guests, Dr. Olumide and Dr. Adefeso, to take us on what stroke is all about. They will give us analysis and in-depth knowledge on what and why stroke matters. Dr. Olumide, thank you so much for honoring our invitation.
You are welcome.
So we'll go straight to the question. I'll start by, as a layman, I don't know anything about stroke. All I used to hear is about when we go to the clinic or people just talk about stroke. But I would like you to give us an insight of what stroke is all about.
Thank you so much for the question. Let me give a scientific definition first, and then I will explain what that actually means. Scientifically, we define stroke as an acute onset or a sudden onset of global or focal neurologic deficit of vascular origin. Traditionally, we usually say lasting for more than 24 hours, but in recent time, there's been a change to lasting for about 1 hour. Even at that, there's still some modification about the definition. What we mean by a focal or a global neurological deficit in a layman's language is something happening to either a part of the brain or the whole of the brain. So focal if it happens to a part of the brain, and global if it happens to the whole of the brain. And by neurological deficit, we mean impairment in the function of the affected brain tissue. And then when we say it's of vascular origin, what we actually mean is this, that the basic thing underlying the mechanism of development of stroke is an affectation of the blood vessels. And that's what we mean by that. And then the time frame, which could be 24 hours traditionally, or in recent times that we talk about 1 hour, or anything giving us evidence of stroke on a neuroimaging. So if I were to talk about that, then we'll say anything happening suddenly as a result of problem in the supply of blood to the brain, affecting any part of the the body that brain tissue that was affected eventually affects. You get. So when such manifests, we say the person has a stroke or he has developed a stroke. So that's the simplest way I can actually put it. Maybe my colleague will be able to help.
Dr. Defeso, as Dr. Lamdi has rightly highlighted to us, so now I would like to know what are the causes of stroke in general? Like, what are the causes? Yes.
Okay, so I just want to shift into its layman explanation and make it very, very simple. Like, we need water from a tap. So the tap brings water to nourish us, to hydrate us. So that tap is like the arteries that is bringing the blood to the brain. So when that is, now if the tap is blocked, you are not getting water. And you need that water to function if your tap is blocked. Or if your pipe, something happens to the pipe and it just ruptures, it blows, and then the water is getting trapped along the root of your pipe. You are still not getting water when you open your tap. So your brain is still not getting blood or oxygen or what it needs to function. So as a result of that, stroke happens. So I think we all have a picture of what stroke really means now. And there are different causes of stroke. We call some modifiable, some non-modifiable. So the modifiable causes of stroke, which we all will benefit from today, are things like hypertension and other heart diseases, vascular heart diseases, cardiomyopathy. We can have diabetes. Diabetes is also a very common cause of stroke. We can have things like atherosclerosis, anything that will cause result in blockage of that pipe, as I've explained earlier, will result into stroke. And while I know that today's definition, we are talking about the effect of stress on work stroke day, the stress ultimately can result in cardiovascular disease, because there are so many studies that does stress on its own, does it cause stroke alone? Or is it that as a result of the effect of stress on other aspects of the body, we can now have stroke? So a lot of people are agreeing on the fact that the effect of stress, mostly on the cardiovascular system, is what leads to stroke. There have not been so many studies that can say, okay, so you're under stress, you will have stroke.
So what you are saying is, if I can get the picture, there is possibility that if you are suffering from, like stress could lead to stroke, or it doesn't equate it, like stress is on its own and stroke is on its own.
Stress ultimately can lead to stroke.
Okay.
But I don't want, at the end of the day, to think that for our viewers or people listening to us, at the end of the day, to think that once you're under some form of stress, because there is good stress, there is bad stress. Once you're under any form of stress, ultimately you end up with stroke. So, but chronic stress can affect the cardiovascular system, and as we mentioned earlier, the cardiovascular system is one of the risk factors to stroke. Being overweight, unhealthy lifestyle, those are also the modifiable risk factors for stroke.
So if I can get that also again, living an unhealthy lifestyle also leads to stroke.
Yes.
So if we are talking about unhealthy lifestyle, what are the things that one engage that you could actually say this is unhealthy?
Smoking, number one. Smoking has been associated with stroke. So smoking is something that we all need to stop doing if we want to prevent or reduce the risk of having stroke. Some people have also suggested alcohol. So alcohol is also a part of unhealthy habit, even though some form of alcohol is good, because we are putting everything in context here today. So being overweight can also result in stroke. Obesity ultimately can also result in stroke. So those are some unhealthy habits. And the thing is that when we add stress in our team to eat, stress also aggravates people acting in all the symptoms, because for some of us, it's a coping mechanism to the stressful event that we are going through. So it can result in aggravating this unhealthy habit, eating unhealthy, smoking, alcohol consumption, lack of exercise, and all those things. Stress can also aggravate those things.
Okay, thank you very much. Dr. Olumide, rightly as Dr. has rightly said, I would like you to also help us expatiate further on what the possible effect of stroke to the body. Like when you have stroke, what could literally happen to you? Your appearance, or what could actually happen when you have stroke?
Thank you for the question once again. Let me start by saying there's this acronym for some of the things that every layman can understand about the symptoms that a patient with stroke presents with. And they use this acronym FAST. The F there, the A, the S, and the T stands for something that we all can easily pick. When you see someone with facial deviation or weakness to one side. Okay, sir?
F is
facial deviation or facial weakness. Okay. When you see someone with facial weakness, or maybe when you tell someone to smile and then you see the mouth deviating to one side, that may be a symptom that the person has a stroke. When you tell someone to lift up both arms and you see that there is weakness on one part of the arm, one drops abruptly, or it can't lift one of the arms, then you might be thinking that the person also has a stroke. And when you see that while the person is trying to talk to you, the person seems to have what we call slurred speech, or the speech is no longer coherent. It's not as if there is a problem with the content of what he's saying, but in the production, maybe the speech is now slower than the way it used to be, or the person now has difficulty in even making words. You might be thinking the person has a stroke. And then the T there, it's time. That's not really a symptom of stroke, but actually something that tells you what to do and how you should act, because they say time and money, you understand? But when it comes to the issue of stroke, you see, time is brain tissue or brain neurons. Neurons are the unit of the brain tissue or the nervous system. For each second that you wait, for a patient who you already think has a stroke, the neurons, which are the things that form the brain tissue, they die. And so the more the neurons that die, the more the complications or the more the, how will I put it now, how dangerous or how bad or how severe the stroke becomes. So once you observe that, the first thing you should do is just to try to see how you can get the person to the hospital as soon as possible. Unfortunately, in this part of the world, we have a very poor illness behavior. When people see things like that, the first thing that comes to mind is maybe someone somewhere has fired a spiritual weapon or attack at the person, or maybe perhaps the person had an altercation with someone some moments ago. They feel, okay, this is the aftermath of what has happened. And all of those things make it very difficult for even we doctors to help patients, because the earlier they present at the hospital, the better it is for them, and the easier it is for us also to help them. So that helps us to, at least for the layman, to understand when you see someone having a stroke. And several complications can come from it, from the symptoms to some of the things that would be the sequelae of the stroke. The symptom, for example, the patient might not be able to speak. That might even be one of the things the person presents with, or the person might have a slurred speech, like I said earlier on. And then the person might have problem with walking because the legs might be affected, the arms might be affected. And these are just the immediate things that happen to the patient. But it is beyond all of those ones.
Doctor, okay? Sorry, can I comment?
Yeah, you can, please.
While you were analyzing it, I pictured something, which is just, you were talking about the neurons.
Yes, sir.
And how do a layman, how do they know when the neurons are weak or the neurons are dying?
Okay, okay. It is not really for you to understand when the neurons are dying or how the neurons die. That would mean you have to go to the medical school, spend 7 years to understand. But the basic thing is for you to be able to identify someone that has a stroke or someone that is about to have a stroke. Let me say this at this point. There's something we call transient ischemic attack, which is like a transient thing, like a premonition that this person, if not well attended to now, or if he doesn't pay close attention to his health, or if he doesn't see the doctor to help him out with his present health condition, might actually develop a stroke. In such condition, what you have is someone has some of these symptoms I have earlier given, but usually always a focal, and it reverses in some few minutes, hours, up to 24 hours. It might even reverse. For example, the person might have weakness in one part of the body, and then maybe 2 hours or 3 hours, everything reverses. Or the person can suddenly observe that he can't see with one of his eyes. Then after some time, everything begins to clear up. That's a sign. It's like a premonition. It's showing you that, like my colleague had said, Dr. Adefeso, that there is a possibility of a blockade in one of the arteries that is carrying blood to a part of the brain. And so the best thing for you to do at that time is to quickly visit the hospital. If you have been visiting the hospital prior to that time and you've not been regular with your medication, it's just good for you at that time to start using your medication and then go to the hospital. So stroke, it's not something we pray for our patients. It's not something you want to pray for anybody, because the complications or the effects, it varies from as simple as the person not being able to talk, and you don't know what it means for you to know what to say, but then not being able to say it.
Exactly.
As in, it's not the case that you don't know what to say, but you just cannot say it. You can't help yourself. We call that aphasia. You cannot say what you want to say.
Wow.
And you know what that eventually becomes at the end of the day for someone, for example, who is a teacher, who can no longer, you get frustrated. And like my colleague had said earlier, that in itself becomes a stressful thing on you. Now I'm talking like the person already is in the hospital and is being stabilized and then still not being able to talk. For that moment, when he regains his ability to talk, he feels frustrated, as in he feels so bad. He might even enter into depression. Imagine someone who is being able to help himself all the while. Now you cannot even stand up from the bed. You can imagine maybe someone who is used to walking around and all of a sudden, I've seen several in the hospital while a commercial, it's even that's one of the reasons why we should pay attention to our health. Imagine that the driver of a commercial bus or it has suddenly develops a stroke. You can imagine what that is. I saw one, the Keke Napep driver in Shagam here, who suddenly develops a stroke. Thank God he wasn't driving at that time. He was at the motor park waiting for passengers. And all of a sudden, he just collapsed. People just saw that he fell from the chair and then he couldn't stand up again. He couldn't use a part of his body and they brought him to the clinic where I was. Grateful that he was not having passenger. Imagine he was on motion and that happened. That in itself could be a cause of a very fatal accident. So, those are some of the things that happen immediately. But beyond that, there are still some other things that can happen. Like they are like long-term complications. For example, the patient, can eventually develop seizure, epilepsy after some time. Even while being treated in the hospital, there's what we call arrhythmia, which is like disordered beating of the heart, and someone can have that. And that in itself can even predispose the person to having another stroke. So, one thing is, prevention is always better than cure. Thank you.
Thank you very much. Okay, Dr. Adefeso, I would like you to expatiate and to ask this question directly. Can one recover from stroke?
Yes. There have been cases of full recovery from stroke. My colleague Dr. Odubeson mentioned TIA. There have been cases of full recovery from that. And even the other stroke where you have weakness of the body, people have recovered over time. So depending on the area of the brain affected, that is what will determine how fast the recovery will be, or the prognosis, or how bad the stroke would affect.
Okay, Dr. Adefeso, can someone have a repeat of stroke?
Yes, it's possible to have a repeat stroke. It's actually not uncommon to have a repeat stroke. After stroke, even during rehabilitation and discharge, there are some medications that the person is supposed to keep on taking. Some other risk factors we still have to continue managing those other risk factors. So if the patient is hypertensive, the person needs to continue taking antihypertensive. If the patient is diabetic, the person still have to continue taking the medication and come for regular follow-up. One of the common causes of repeat stroke is that we lose patients to follow-up, and because they've recovered, they feel that they are fine and they stop coming for clinic follow-up, they stop their medication. So if all those lifestyle modifications are not in place, it's very possible to have a repeat stroke.
What are the psychological effects of stress?
Okay, so the psychological effect of stress. The thing about stress is that psychologically you can have stress, and then you can have, so it's like a vicious cycle, and then you can have psychological effect of stress. So the psychological effect of stress that is very common is that, number one, you have anxiety. Anxiety is very common with people who are under some form of stress. And when we talk about stress, sometimes we don't know that something as simple as marriage, we have a scale, and the commonest one is the Thomas Holmes and Rye scale. And even that, over 100, marriage is a score of 50, can predispose you to stress. And then as it goes up, marital separation is a score of 65, divorce is a score of 73, death of a loved one is a score of 100. So those are, even, sometimes we feel that it's just the job, and, simple things like traffic can actually predispose to stress. And how we cope with stress differ from one person to the other. So all these psychological effects might present in Mr. A, and you might not see it in Mr. B, because how we cope with stress differs from one person to the other. So if you're constantly having poor sleep, that ultimately can result in mental illness. People with stress, they can have depression, especially if it is from things like loss of a loved one, job performances, from separation, from even a physical illness. Physical illness is a score of 53 on the scale of, and we mentioned that even stroke that we are talking about can lead to stress. So when you are psychologically, you have issues with anxiety, you cannot think properly, you're not able to focus, your productivity level is reduced, it begins to affect you as a person. It affects your confidence, it affects your self-esteem, it affects your self-confidence, and ultimately it can result in mental illness. Common one include depression or labor mood disorder, mostly mood disorders.
Dr. Lumide, how do you manage and prevent stroke?
Thank you so much for that question. Medically, when we talk about prevention, we talk about it on 3 levels or on 5 stages. But I would like to just answer as it regards 3 levels. We talk about primary prevention, secondary prevention, and tertiary prevention. By primary prevention, we talk basically about all the things you do in promoting health education, giving awareness about the condition itself. And the media is going to really help us. And I believe that's one of the things that this discussion affords us, to enlighten the populace about the possibility of developing a stroke. Most people who eventually come down with stroke don't even know they have an underlying condition that would tilt them towards developing a stroke. So I would advise the public at least once in every 3 months or once in 6 months, visit the hospital, do a medical checkup, let them check your blood pressure, let them check your blood sugar, let them screen you for some basic things, check your fasting lipid profile, know if you already have some lipid disorders that can tilt you to developing a stroke. If you're a sickle cell patient, for example, try as much as possible to visit your physician as regularly as possible, so that you could be well taken care of, because sickle cell itself is one of the predisposing factors to stroke. So that's on the primary level. And then we talk about the use of some, what we call blood thinners in layman's language, to prevent stroke in some group of people who already have an underlying condition, like maybe the diabetic or the hypertensive patient. Even though in recent time it's been said by research that the use of some of these blood thinners is not really of help in people who don't have underlying medical condition, but those who have had maybe a heart attack before, or who have a diabetes mellitus, or people who have suffered some other things that could predispose them to having a stroke, might be placed on these blood thinners. A common one is aspirin, that we all know. Don't just prescribe it by yourself. Let your doctor do the prescription for you. And by secondary prevention, we talk about how to detect stroke early enough and how to treat it. So I would just say the detection of stroke hinges not only on the physician, also on people around. Ability to identify that this is likely a stroke and not an attack from evil people around you. Most times people think that everything that happens around them is from their enemies somewhere, or people of their father's house or mother's house who are against their success. But you see, spiritual things are not amenable to medical intervention. So when you bring someone to the hospital and the person recovers, it's not likely to be a spiritual attack. And most times we have lost so many people to all of this, mystic opinion about something not being medical. And, as the Yoruba people will say, they will say you should go back to the traditional things. Even traditional healers come to the hospital. Don't be deceived, please. I've told you an acronym to identifying someone that has a stroke, but it goes beyond that. But for you as a layman, fast. You see someone with facial weakness, you see someone with weakness of one part of the body, you see someone with slurred speech or difficulty with talking, immediately take the person to the nearest hospital. And then in the hospital, leave everything to the hands of the doctor. I can't teach you how to treat stroke because you are not trained to do that. But once you get to the hospital, everything will be done the way it should. And please, let me give this warning. There is this popular opinion by people, who have been off their medications and then develop a stroke. The first thing they want to do is to start their medication. If you are hypertensive and you develop a stroke, please do not take your antihypertensive drug. Let the doctor determine, because it worsens the stroke you have. Many people don't know. Once they see a weakness of their body, they say, he has not been using his drug, let's give him his antihypertensive. And rather than helping him, they worsen his condition. Please, do not give antihypertensive to a patient that you think has a stroke. Let him get to the hospital. The best you can do is to give aspirin. And even at that, it is not in your hand to determine. But if you think you can, please, why not? And then the tertiary is about how we rehabilitate them. Some of them comes back with weakness of a part of their body, and they have to cope with that all the days of their life. And so we need medical rehabilitation, occupational therapy. We need speech therapists to help people who have difficulty with talking We need the physiotherapists to help those who have difficulty in walking, difficulty with their daily activities. And so there is need for rehabilitation. And this rehabilitation also, it goes beyond the physical therapy. It even gets to psychological therapy, where you help the person come out of all of the mental issues that come up because of what he has gone through. And at the same time, how you reintegrate them into the society. Someone who was a soldier before and now has a stroke can no longer carry a weapon with his, what's it called? I think, such might need to be reintegrated again into the society. And with all of this, I believe that every one of us will be able to, at the right point, prevent stroke as much as possible and help people who already have stroke get the best care. Thank you so much.
Dr. Professor, please, I would like you to help us close this engagement by telling us how we can manage and prevent stress.
Okay. Thank you for the question. Stress is something that we cannot prevent. Every day of our lives, we will be faced with one strenuous event or one stressful activity or the other. The most important thing is that we all should learn how to manage stress, how to cope in the midst of chaos, how to cope despite everything that is going on in our lives. And the very first thing that we need to do is to identify the problem. Whatever problem that it is we are facing, is it an illness? What is the problem? What is the solution to this problem? Is it a loss of job? What is the solution? Is it financial crisis? What exactly is the problem? What is the solution to this particular problem? Do I need to call my family? Do I need to get a loan? What exactly am I supposed to do? So identifying the problem. Now the next thing is that what are the resources that you need to solve the problem? What are the resources that we need? Sometimes it can even start from little resources like energy and emotion being present in some little things that causes stress in our daily lives. So what are the resources? We identify the resources rather than overthinking and thinking of the worst case scenario, which is what most of us do as humans. And at the end of the day, it does more harm than good. So we identify the resources, and the next thing is social support. We all need support. We cannot exist as an island. We all need support from people in our lives, from people in the place of work. Are you going through work stress? Your boss or your superiors might not even know that the job responsibilities, the job requirement is too much for you. And at the end of the day, you get blamed that we were not aware. But if you have made it known, we can start having the conversation of what are the things that we should reduce. Maybe your stress is traffic, and you're like, can I work from home 2 days a week? You can begin, once you have value to offer, you can begin to talk about how to cope in situations like that. So managing stress differs from the stressor. The stressors are the life event that is resulting into the stress. So once we identify that, then it will be easy to manage it. But on a day-to-day activities, what each and every one of us can start doing from today, the very first thing is exercise. Exercise is the most underutilized antidepressant on the planet. So exercise releases your endorphins. It makes you happy. It releases all your feel-good hormones, so that I will not give you or bore you with medical jargons. It's something that we all should do. When we talk about exercise, especially in this society, we feel that exercise is just for people who are trying to lose weight. But that is not true. Beyond weight loss, the numerous benefits of exercise is just so much. There are also foods that boost your immune levels, that boost your mood. Talked about the likes of yogurt, bananas. They are food that boost your mood, and they are healthy as long as you're eating them in the right portion. And then we start talking about, trying not to wait till the last moment before you get things done for things that causes personal stress. And seeing a mental health expert. Some people have even come up that one of the reasons why, especially for stress from marriage and the like, why therapy doesn't work is that we seek therapy when there's nothing can be done again. At that point, there's so much water under the bridge already. But people have begun to talk about if you seek therapy early, so many things can actually be prevented. So talking to someone. Other things that are very helpful personally is meditation. Meditation is very good, and there are so many meditation apps that are available that we can download. We are all using Android or Apple phone, there are so many meditation apps that we can download. 3-minute meditation, 5-minute meditation. Journaling is also very good. It helps you cope with stress, and it helps you to distress because you're writing whatever is going on in your head down. And for some people, because some people who are living a very stressful life, there are some supplements that we call adaptogens, and they're readily available. Things like ashwagandha, American ginseng, they are very, very good in helping people manage stress. But these supplements, they are just addictive. So we still have to start from all the lifestyle modifications that I've mentioned earlier to manage stress and cope with stress. And also, you don't want to take in too many things. You don't want to be doing this at the same time. And I know that this is the time where we all have our day job, and then we have our side hustle, and we don't sleep well. We sleep for 2 hours, we sleep for 3 hours, and at the end of the day, before we know it, we are experiencing burnout. So we also need to know how to prioritize, how to manage our time, how to delegate, and do things like that so that we can manage stress and we can live a more productive life.
Dr.
Right now, we all know that saying that we have a stressful event in the nation is an understatement of the century. And a lot of people, legitimate business owners, have lost so many things. Some even, the goods in their shop is from one loan or the other, and they don't even have insurance for their store. They are under so much stress. Stress from the loss of a loved one, stress from having a loved one in the hospital right now. I want to say that helplines are available, and I'm sure that in the caption of this video, they'll probably put some helpline of people we can contact to talk to and better cope with stress. And right now, some people are even giving funds to support people who lost things to looters. But I want us to go home with this take-home message, especially those people who have been affected by hoodlums or looters, or by one way or the other through this exercise, that this is not the end, that this period will pass. I want us to think of the positive. I want us to be grateful for the gift of life. And I want us to know that this is not the end. This time will pass away, and we are going to be restored into the perfect person that we are supposed to be. So let us seek help. Let us not think that it is over and nothing can be done, or you can no longer be saved. Help is available. Let us seek help. Thank you.
Yeah, it's really a trying moment in our country at this time. I want to use this opportunity to commiserate with everyone who has lost a loved one or a friend during this NSAS protest, and those who have been injured in one way or the other, whether physically or emotionally. I believe in a great Nigeria. I believe in a good government. I believe that everything is going to be, what we expect it to be. And as we go about the protest, whether on social media or physically, we should be mindful of the fact that, there are stressful moments, and then we need to learn to have a coping mechanism for all of the stress that would come from all the things that we'll be engaged in. And also, finally, everyone out there who has never visited the hospital before, I think it's an opportunity for you to visit the hospital, have your medical, checkup done for you by the physician in the hospital, know your health status, and then know if there is a need for you to be started on some medications or not. And as my colleague has said, try as much as possible to engage people. If you think you need to talk to people, just try as much as possible to do that. I believe we are going to have a good health at the end of the day, both for ourselves and for our nation, Nigeria. Thank you so much.
On this note, I would like to say thank you to everyone for staying tuned. Thank you to the organizers of this event. And to Remo Gooners, most importantly, I want to wish every one of us happy World Stroke Day. Please take note, stay healthy, stay positive, and thank you all very much. Up Gooners for life.